From the Einstein Healthcare Network studios in Philadelphia, this is Health and Wellness.
Hello, everyone. I'm Genaye Channel with my co-host, Dr. Andy Rosenzweig, Division Chief and Fellowship Director of Geriatric Medicine with Einstein Healthcare Network. And this is Aging Gracefully. Our topic, dementia. What exactly is dementia?
So dementia is a chronic progressive illness we commonly see in older adults, characterized by deficits in short-term memory, as well as some other area of thought process. The combination of the two is significant enough to affect daily function.
So how is dementia diagnosed?
Dementia is diagnosed clinically, so we don't have a blood test or an X-ray to help us with the diagnosis. A lot of doctors use tests, memory tests, other question and answer tests that test the different parts of the brain, as well as short-term memory. But what I do personally is just have a good long conversation with the patient and the family. And hearing stories and a history of some short-term memory lapses followed by some more significant functional impairments usually leads me down that road. Now, we talk about dementia, and that's the blanket syndrome, but there's a handful of dementias. Most commonly is the Alzheimer's type dementia, and that's by far and away the majority, probably 85% of all cases. But then there's a few other ones less common. There's one called vascular dementia, another called Lewy body dementia. Each of these have their own little nuances that help point us in a certain direction, but all of them follow that same initial definition of cognitive changes significant enough to affect activities of daily function. So
how is dementia treated? I know you've said that there's various types of dementia, but overall, how is it treated?
Unfortunately, we don't have any really good treatments for it. There are a few pills approved out there that treat dementia, but nothing actually reverses the clinical process. Some of them are thought to slow them down, but there's no way we can make it go away like an antibiotic can make an infection go away.
Sure.
It just doesn't work like that.
So what are some things that family members should look out for if a family member is exhibiting signs of dementia?
They should always call their doc right away and try and get in for a visit. Things they'll start noticing first are simple things we all do that are normal parts of aging. Maybe forgetting where they put their keys, or having words on the tips of their tongue that they can't get out, or name recall issues. And then from there it'll progress such that maybe now they're messing up on their checking register. They're maybe getting in some fender benders, maybe getting lost or confused. And when you start seeing those changes in a chronic progressive fashion, that's when it's time to come and have a good talk with us.
So is dementia reversible?
No, unfortunately, it's not reversible or curable. It's a chronic and progressive condition. It's a challenge because it's not something you can see or, like I said, diagnose with a blood test. It's this clinical scenario, and you're seeing these changes in a loved one that are hard to explain. Some people put dementia on a spectrum with normal aging, but it's clearly off the trajectory of normal aging. There are, in theory, ways to slow it down or keep it at bay, but nothing to make it go away.
So what are some ways that dementia can be slowed down?
From an evidence perspective, there are two classes of medications that are approved by the FDA for the treatment of either mild to moderate dementia or moderate to severe dementia. And these are marketed for the Alzheimer's type, which is the most common. Personally, I don't feel like they do a ton of good, and I hate to add on medications that are likely going to interact with other medications if I don't feel there's a lot of benefit. So what I am really, what I always try and stress is with the family to keep the patient stimulated. I liken the brain to another muscle that needs to be exercised. So then people always ask me, oh, so I should get mom crossword puzzles and Sudoku and teach her chess. Not necessarily. What I've seen work the best is just being socially active. So Grandkids are by far the best medicine for dementia, as far as I'm concerned. Interacting with family, anything to just keep them away from just sitting in the chair and watching television all day. For people who can't be around a family all day, I strongly recommend adult day programs. We have tons in our community, and they're a great way to get people with usually a lot of similarities together to communicate, socialize, laugh, do light activity, and that works much better than any pill in my experience.
So what should we as healthcare consumers know across the board about dementia?
Well, we have to recognize that it's a huge geriatric medical issue. It's up there with diabetes, osteoarthritis, heart failure as a prevalent cause of death in our older adults. I think we need to support causes that will help fund research so we can find a cure. And I also think it's important to recognize when your gut tells you, all right, these memory issues or functional issues are a little more than just mom's normal aging process, it's time to say, this could be dementia. Let me go talk to my doc about it.
Thank you so much for sharing this great information.
My pleasure.
Be sure to watch more episodes on this topic and other issues of interest to all patients here on Aging Gracefully. We will see you next time.